everybody. Welcome to ABA Inside Track, the podcast that's like reading in your car, but safer. I'm your host, Robert Perry Cruz, and with me, as always, are my fabulous co-hosts.
Hey, Rob, it's Diana.
And it's me, Jackie.
Well, it is a real treat. Our episode's coming out in November, and one of the things we have to be thankful for is we have so many fabulous practitioners who are taking time out of their day to talk about behavior analysis and behavior analytic research with us this month, which is, again, also the theme of our podcast. That's the theme of our podcast. Not the content, just the theme, the theming. And this is another great episode with a great guest. We've wanted to do an episode on the topic of timeout for quite some time now, but we weren't going to do it without a very special guest joining us. And luckily, the stars have aligned, and she is here tonight. We are joined by Dr. Jeanne Donaldson to talk all about timeout. Jeanne, thanks so much for coming on the show tonight.
Thanks so much for having me.
You know what? I didn't check if everyone's a big fan of timeout. I think one of the things we're going to talk about is timeout as something that I think we all know. We all know from probably our own childhoods and from our own practices, but it does seem to be a procedure that may not be as well received as it used to be, even though it is one that I think is still pretty popular in terms of usage, not popular in terms of people are writing, Instagram posts about it necessarily. And what we'll be talking about tonight are articles mostly by Dr. Donaldson talking about timeout as a procedure, but also having a chance to talk about timeout as a procedure that is potentially being misunderstood, misused, and what does that mean for practitioners who might or might not then recommend timeout. But before we get into all of that, Jeanne, why don't you tell our audience all about you?
All right. So I am an associate professor at Louisiana State University. I am in the school psychology area, although I'm not trained as a school psychologist, but our program is a very behavior analytic school psychology program. And so I'm just going to put in a little plug here at the beginning and then maybe again at the end. For any listeners who are interested in pursuing a doctoral degree, our program affords students training in school psychology and in behavior analysis, which allows students to get licensed as psychologists as well as their BCBAD if they choose practica that align with that. So we have a really cool program. And we're housed in the Department of Psychology at LSU. I earned my doctoral degree from the University of Florida. Go Gators. I'm still a Gator fan. And I worked with Tim Vollmer. And after that, I completed a postdoctoral fellowship at the Johns Hopkins University School of Medicine and Kennedy Krieger Institute under the mentorship of Sung-Woo Kong.
I know all those names you mentioned. That's pretty awesome.
Yeah, I have had the wonderful good fortune of having a long string of really fabulous mentors.
I feel like, folks, when they're either in the Florida area or the Midwest, it's like they just have this litany of great mentorship. And it's one of the things I think you get a little bit more up here in New England in the past. Well, actually, no, I guess for some period of time you could get that. But it always feels like those are those hot spots where if you're fortunate enough to go to those schools, you just have such great, kind of a great learning history to build off of. So that's so excellent.
It also sounds like your program's pretty excellent too. I think, getting to do a little bit of everything, right? Have the specialization in ABA, but also school psychology. That sounds like so kicking.
Yeah, it really affords students lots of different job opportunities. So if they are interested in going into practice, students get experience working in schools, they get experience working in clinics. As licensed psychologists, they just have a lot more flexibility in patient populations that they can serve. But also it opens a lot of doors in academia, allowing students to pursue positions in ABA programs or in school psych programs. So, and we're kind of a little program, but we're a really tight-knit group. And so I think it's the best. I love our program.
Oh, good. It does offer a lot for the students. It's very cool. Well, we have 3 articles about timeout that we'll be discussing tonight. So I will tell our listeners what those are. And the first is, what is it to discipline a child? What should it be? A reanalysis of timeout from the perspective of child mental health, attachment, and trauma by Dads and Tully from American Psychologist, 2019. And then our 2 articles by our special guest, Effects of a Reduced Timeout Interval on Compliance with the Timeout Instruction by Donaldson, Vollmer, Yakich, and Van Camp from the Journal of Applied Behavior Analysis, 2013. And an evaluation and comparison of timeout procedures with and without release contingencies by Donaldson and Vollmer from the Journal of Applied Behavior Analysis, 2011. So let's get started in talking about timeout. So, Jeannie, would you like to do the sort of elevator pitch for timeout for, I would hope, almost no listeners, but maybe there are a few that haven't thought about timeout in a while or just hasn't really crossed their minds, the behavioral principles of timeout?
Sure. So timeout is defined as a negative punishment procedure. It involves the removal of access to positive reinforcers for some period of time. And that's really the gist of it. And I'd like to add a little bit that will be maybe new to even your longer time behavior analysts and listeners, but I conceptualize timeout not only as a negative punishment procedure, but also really as a differential reinforcement procedure. So the nice thing about timeout and negative punishment procedures in general is that in order to remove access to reinforcers, you have to first have access to reinforcers. So it requires first a consideration of the time in context. And the time in context, in order for timeout to be effective, needs to be enriched. You need to have a bunch of reinforcers, either contingent reinforcers, so engaging in appropriate behavior gets you access to reinforcers, or non-contingent reinforcers, you get them for free, or some combination of the two. And then removal of access to those things, sucks. And so it functions as a punishment procedure that reduces the future likelihood of behavior. So yeah, I guess that's my elevator pitch on timeout.
I honestly never think about that. I think never in terms of differential reinforcement. Certainly, I know one of the criticisms of how timeout can be used is when timeout is used sort of in isolation without any sense of what would the timeout environment be. Certainly in that regard, I think that is an important piece to keep in mind for anyone who is thinking about the use of timeout or how timeout would or would not be effective.
The timeout and the time in environment as well. So if your time in environment is not enriched with the necessary and meaningful reinforcers, then you don't have the distinction between the two, which is where the differential reinforcement comes into play as well, I would think.
Yeah, I think we do sometimes forget that the name of timeout is really timeout from positive reinforcement. And so when we talk about using timeout in isolation or even evaluating timeout in isolation, it's never really in isolation, because the most important feature of whether or not your timeout procedure is going to work is what your time in looks like, at which it needs to have reinforcers. So, and same with response cost, so I know this whole podcast is about timeout, but I think that's in part why negative punishment procedures are still a bit more socially acceptable and why they're included in lots of behavioral parent training programs, because they require, you still are also teaching other relevant skills to parents in this case of, you need to enrich time in, like don't forget about reinforcers need to be available in your child's life, at least in order to make timeout procedures work.
And Jeannie, why do you think parents and professionals use timeout so much at home and in the classroom? Like, why do you think that's sometimes the first thing to do?
That's a good question. I mean, I think timeout it's been around for so long as a procedure that parents use. And so I think some of it is just one of those, like it gets passed down as, generational, my parents use timeout, therefore I use timeout sort of thing. And it also, it works really well. If arranged appropriately, it's a really effective procedure that then you don't have to use very often, right? So that's the beauty of punishment procedures. And, certainly we can talk about lots of negative aspects of punishment as well. But the good thing about using punishment procedures is when used appropriately, you don't have to use them very often. The child doesn't need to contact timeout often to see substantial and immediate reductions in problem behavior, which then, that's also, I think, a really nice feature of timeout, that when it's used appropriately, it can be used very sparingly.
Jeannie, you spoke about sort of the age of timeout in terms of its place in parent training. It does seem to be one of those procedures that I know sometimes I even think about, taking it for granted as, that it just works. It's been around forever. And yeah, like you said, my parents used it and their parents maybe used it as well. And I think some of that might be just the overall effectiveness, or just the ability of parents to just like see that success right off the bat, or well, hopefully if it's done correctly. But I know, we were talking a little bit before we recorded that in recent years, it does feel like even though everyone knows of it and might use it, it does seem less popular to some extent nowadays. Like I know personally, when I've recommended timeout as part of a behavior intervention package, everyone looks at me like, well, what pioneer school did you originally work at, sir, that timeout would be recommended? Any thoughts as to why that might have shifted in the past, I don't know, 10 years or so?
For sure. First, I guess I want to follow up with you on who are the people that tend to kind of bristle at the suggestion of using timeout?
So it's typically professionals who are either like counseling. Actually, I don't think I've had any school psychologists who've had any issues with this, but it's typically either been teachers or counselors who have seemed kind of surprised. Or they'll say okay, but then you'll catch them during timeout, like being in the same space as the child in timeout, like talking with them and trying to make sure that they're feeling okay, and sort of defeating the purpose of using timeout as part of the intervention process.
Yeah. So I find the people that tend to be most opposed to the use of timeout that I interact with tend to be like school administrators or behavior analysts or other kind of professionally trained people who aren't necessarily the ones that are kind of boots on the ground. So most preschool teachers that I've interacted with, either they might not call it timeout. So maybe they prickle at the name, but otherwise they attempt to use something that is functionally a timeout. I think it still gets used quite a bit, but I think like a lot of punishment procedures, I think it's gotten a lot of new names in order to make it seem more accessible. So I think the reason that there's been a pushback against timeout, at least in part, is that there is a really ugly history in the use of timeout. And I don't mean to say history, I guess, because it's still, timeout procedures still get horribly misused to the point of abuse. It wasn't, maybe I was a postdoctoral fellow when I read a news article about a child with disabilities was placed in a closet at school and maybe engaged in self-injury and was severely injured during timeout. So, I mean, these sorts of awful things still happen. And so I think that there is good reason for people, if you just throw out the idea of maybe we should use timeout, to step back and say, well, what do you mean by timeout? Because I think what a lot of people still think of is some sort of isolation room or an exclusionary timeout that I think has a lot of abuse liability.
Mm-hmm. I know here in Massachusetts, it's actually in the law that timeout is legal, but it is described as a calming procedure in the legal language, which to me always felt like, I guess I understand why they would phrase it that way, but I always worry it's one of those, doesn't this sound nicer now? Redefinitions that might end up doing more harm than good in terms of having, generations of practitioners either too scared to use what would be traditionally considered timeout, or they would turn timeout into some sort of like a counseling session rather than the procedure as it was developed and as it is historically been used.
Yeah, and I think issues with calling it a calming procedure, or I hear some schools have something like a thinking corner, is that what tends to happen then is people using those procedures think, and rightly so given the name, that, oh, well, I should include some things in that space that would be calming. Like maybe we'll put some bean bags in there or some stuffed animals, or you can find on Pinterest these timeout things that you can like shake and it's got liquid in it and glitter. And then the kid can like flip it over and see the glitter falling.
Very cool. Yeah.
Yes. Oh, these, I mean, I want one. They're beautifully fun, but probably would, contingent access to these things might function as a reinforcer, which then what you're implementing is not timeout.
Right. And those may certainly have their time and place, right? We want to be teaching calming strategies, but they would not function in the same way as timeout from positive reinforcement if that is the direction that we're trying to go with the behavioral program.
Yeah.
I know I've seen a lot of timeout when it's just like when you're putting a chair right to the side, right? You're like, I want you to sit here for just 5 seconds or like a minute, right? To just...
Yeah, the sit and watch, right?
The sit and watch, yeah. I couldn't remember what it was called. Full disclosure, I use that with my own child, right? When it's appropriate. And so I haven't seen any issues around that type of timeout, but I have seen somewhere it's more the exclusion timeout.
Yeah, I think both of my kids also experience timeout of the sit and watch variety. And I think that's also, when I think about timeout and and the timeout that I would advocate that people would use, it's always a non-exclusion timeout where, yeah, you're, sit on the side for a minute and see everyone else still having a great time and time in, and then rejoin us when it's over. And so that procedure is, I think, very different from the kind of isolation, exclusion, timeout sort of situation. However, the behavioral parent training programs, and I guess maybe we'll get into this more when we talk about the release contingency study, but recommend that as the method for reducing problematic behavior during timeout, they suggest that then you use a backup exclusionary method. So the child is engaging in problematic behavior during timeout, like engages in aggressive behavior toward the person implementing timeout, then you put them in an exclusionary timeout. I think that is a problem because most people don't have a reasonable, safe, empty place to put a child where they can still be monitored and supervised. And so I think that's where we start to lead into issues with timeout.
Right. I actually remember one time I got put in timeout when I was a young child, and I got put in timeout in my room, and I was like, this is amazing. Yeah. I'm just going to sit here and play with all my toys, and I'm supposed to be in trouble, but I don't feel like I'm in trouble because now I can play with Legos for like whatever. Mom's like, you can leave now. I'm like, I don't want to. Like, I'm having fun in here.
Sometimes I feel like you sort of have to count on that weaker exclusionary timeout where you're sort of in your room and like technically you still have lots of fun things is, well, the FOMO of being there will make my child want to leave their room at the moment. But it sounds like it did not work for you, Jackie.
It did not. I was like, this is amazing.
And that's why you became a juvenile delinquent like in those old 50s movies. Bobby Soxing and whatnot.
Well, and that's why I think we need to, as behavior analysts, remember that timeout is defined functionally. So,
yes.
Wouldn't expect a subsequent decrease in your problem behavior following being sent to your room with all your Legos. But I think we also get caught up in thinking of timeout as a place, but timeout doesn't have to be a place. It doesn't have to involve moving anyone physically at all. Maybe I should have had everyone read the Fox and Shapiro paper, the timeout ribbon paper.
We did that on an episode
Group
contingencies. Yeah, way back when. Yeah.
Perfect. You know what? Now I think I listened to that episode. So I'm glad I didn't reassign it. So you're all familiar with the timeout ribbon. So you don't even, it can be timeout and no one has to even move. So yeah, I think better to think of it functionally as you're just removing access to reinforcers. And frequently that does involve moving the kid to a different place or moving the individual. I always think I work with young kids. So I think about young kids when I'm implementing timeout. If you don't work with young kids, then you're probably looking at something like the timeout ribbon instead, because once you get into issues of, we'll talk about the 2013 paper, but lots of times people don't go to the timeout place when you tell them. And so as a safety sort of thing, if you're not working with tiny kids, then I think not having to move them is a nice benefit.
So Jeanne, in terms of talking about timeout as an appropriate treatment, so beyond sort of just talking about the behavior analytic underpinnings of its usage, is the Dads and Tully article one that you sort of just found as you were continuing your own research, or one that someone recommended to you as a good review for non-behavior analysts to look at, to explain, how timeout can be used appropriately and is not, a traumatic event in its own right?
I guess I would say most of my research is done with typically developing kids in common settings, so at their school or in their home. And so then my research areas tend to kind of interface with other people who work with those same populations. And child clinical psychologists being now the group that basically owns timeout. Behavior analysts generally don't recommend it anymore, but clinical psychologists love timeout. They suggest timeout like candy, like, oh yeah, timeout for that, timeout for everything. I always do timeout. In part, then it forces me to read papers written by people outside of behavior analysis and publications outside of the typical behavior analytic journals. So I try to keep up with literature in timeout and the good behavior game, which is another area of research that I do. And so I end up reading a little bit more broadly. Ed Morris sent me this paper when I was having a little bit of trouble finding who has the rights to claim the name of timeout as a clinical procedure.
I was going to ask you that.
Oh man, I don't think I am expert enough to speak on this, but Ed Morris and I had a good email exchange, and he is writing a paper or maybe a series of papers on the history of timeout. So he's really the person to ask. But he also sent me the Dads and Tully paper, and I thought it was great. But yeah, so I guess Mont Wolf is in the behavior analytic world mostly credited with it because the original paper, the first paper that states or that uses the term timeout as a clinical procedure is the Wolf, Risley, and Mies paper, the old like Dickey paper. So, gosh, what's the year on that? I think I wrote it down. It's 1964, so it's pre-JABA. But Arthur Stotz also claims that he was the originator of timeout. And so, but I can't find a paper that links him, but Mont Wolf worked with him. So there's perhaps some argument over who gets to claim the name.
I was reading something about that where Arthur Stotz said, this is something I used with my daughter, or like it was something that he just did at home, but it didn't have a name.
Yeah, so I don't know if he came up with the name, but I mean, the name timeout also, was used by Forster and Skinner way before that in the Pigeon Lab. So, as a clinical procedure, maybe Mont Wolf or Art Stotz can claim the name, but certainly it was used as a behavioral procedure before that in the lab.
Well, we may never know who owns all those timeout millions that was made.
It's so interesting. I must say that you're saying that you see clinical psychologists use timeout more so than behavior analysts now, because I don't think I realized that component. But since I'm less familiar with that literature, is there a focus still on thinking of it as a function-based treatment or not so much?
I don't know. So also in my department, I interface with some really great child clinical psychologists. Mary Lou Kelly, who you may have read some of her older papers in JABA. I don't know that she publishes in JABA anymore, but she's one of our clinical faculty. And then Paul Frick is also another clinical faculty member in our area. And the two of them have kind of old behavior analytic roots. Neither of them would claim to be behavior analysts, but it turns out that lots of clinical psychologists have training that at least involves lots of behavioral principles. And so they also get a lot of other training. And like I said, I think most clinical psychologists would not claim like radical behaviorism as their worldview, but a lot of their procedures are borrowed from our basic concepts and principles. And they're also, in general, at least the ones that I interact with in general, are very aware of that. So they see timeout, like in the Dads and Tully paper, they describe timeout as, coming from operant conditioning. They give credit to Skinner and Mont Wolf, and even though neither of them are behavior analysts. So I think sometimes we forget that there are a bunch of people that are doing what we might consider behavior analysis, and they would consider it child clinical psychology. But I think there's a lot of room to, build bridges across these groups because we actually do a lot of the same things. We just talk about it differently. So you notice in the Dads and Tully paper, they spent a lot of time on different theories, although aligning with the notion that timeout is an appropriate procedure no matter what theory or theoretical perspective you're taking.
I thought that was a fascinating section of the paper, just in terms of, this section is all about, attachment theory, or like you said, Jeannie, this is the learning theory segment. And while all of them had sort of different kind of understandings and sort of underpinnings as to how would you conceptualize why timeout does or does not work, they did all sort of come up with, I think, some of the similar themes, in that timeout being, for use with operant behavior, timeout being a means for parents to use discipline as a calm and structured and kind of prescribed, almost learning opportunity of, this is when you go to timeout for these behaviors. And even some of the more, I don't want to be dismissive of them, but kind of, freewheeling kind of psychological standpoints still did talk about timeout as being, like it's values driven. But again, values in terms of, these are the rules that would be followed, or these are the contingencies that the parents would put into place. So this is why that parent or that parent would, use timeout for behavior X or behavior Y, which I hadn't really had to read about any of those theories in a very long time. So I appreciate you recommending this one as kind of a nice review of some less well-traveled thought processes.
Yeah, I think it's also nice to read up on, so like I said, clinical psychologists are really the ones who are training parents in particular to to use timeout procedures. And they're also really the advocates for safe and appropriate use of timeout. And when in the popular media, when timeout has been heavily criticized by people with no real training or credentials to be doing that, but selling popular books, it's been child clinical psychologists who are the ones putting out the press statement saying this is not true based on what we know from the research. And so I think it's good too, because lots of attachment theory is popular among parents who read parenting websites and things like that. So you don't have to have any real training in psychology to start having concerns about timeout because of attachment issues or what any of the arguments. So I think it also kind of adds to our potential arsenal of, if you are thinking that timeout would be an appropriate procedure for someone you're working with, and you hear a parent or a teacher or an administrator express concerns along the lines of things that come out of one of these theories, then it's nice to kind of be able to talk in the way that they talk and allay their concerns using their language. So yeah, I think it's helpful to read papers outside of behavior analysis, if nothing else, to give us some additional ways to think about the same things that we've been thinking about.
We're big fans of Glenn Latham's The Power of Positive Parenting book, not only for its alliteration, but also for some of the content.
For the awesome cover.
I love that you mentioned that. My history, the whole reason I got into timeout was because I was doing parent training using Glenn Latham's Power of Positive Parenting curriculum.
That's so cool. He certainly mentions in the book he does classes, he does courses with parents, but I didn't know there was an actual. Actually, I don't think we talked about like a published curriculum or something that could be used by other practitioners out there. That's great.
Your initial question that then I think you cut short when you asked. So you asked who I am, and then I gave you my short version. The second part of your question that you didn't ask was, how did you get into this line of research, which goes a bit further back into my history. And when I was a master's student at Florida Tech, and I was doing my practicum with the Behavior Analysis Services Program. And this was a statewide program in Florida that served parents who were involved in the child welfare system. So parents, foster parents, adoptive parents, and parents who were court ordered to take parenting classes. And this program used Glenn Latham's Power of Positive Parenting curriculum as our curriculum for parent training. And so that was how I got involved with that. So yeah, there is a curriculum. I don't know if it's been updated. This is a long time ago now, or if anyone is still using it. But I think about it a lot, actually, now that I am a parent. I wasn't a parent at the time, and now that I am, my pre-parent training self has a lot of good suggestions for my failures as a current living parent.
Oh.
Isn't that the way it goes?
There's no failures in parenting. If your child is alive and they've smiled that day, you've won.
It doesn't always feel like that, but yeah.
Jackie, that sounds like a new book you could get published. It's like, if your child is smiling, you won.
I've already started working on it, even if they're smiling at you and not with you.
They're smiling because you've gone to sleep and they don't have to listen to you anymore. They're so happy.
Yeah.
After the preteen version.
But I do find Dr. Latham's book just so comforting in the way that he lays out the argument that you are the parent and it's important to establish these rules for your child, and that having those rules and having that structure is going to make them feel safe and allow them to fully develop in a safe space. So I feel like this fits really nicely within that parenting view that he's created, and really felt supported by the dad's article.
Yeah.
Tully, Dads and Tully.
Yeah, and that's how, I'm not sure how familiar you are with the other behavioral parent training programs like parent-child interaction therapy and The Incredible Years and the program that came out of Gerald Patterson's work in Oregon. But all of those programs they're all created by clinical psychologists, but they're very behaviorally oriented. I mean, you would find them very familiar and comforting in all of the same ways. And so there are lots of great and evidence-based parent training programs. And all of them, or at least all the ones that I'm aware of, include timeout as one of the foundational skills that they train parents to do.
It did seem from the Dads and Tully article that looking at, the use of timeout in terms of working with children with trauma, that one of the reasons that there was a it wasn't a full recommend, like they've done all the research, or there's been a lot of research in terms of timeout specifically with children with trauma. But it did seem that looking at the populations that many of these parenting strategies that include timeout have been used with did show, some signs of less trauma, or some of the outward signs of trauma. Is that something that you found to be helpful in terms of, explaining timeout to people who might be reluctant to use it, that there isn't really any research to support it as a traumatic event in itself?
I don't know. One issue with the timeout literature that's come up is that nowadays, aside from a handful of studies here and there, most of the research on timeout is really research on these larger packaged parenting interventions. So what they're citing as evidence in support of using timeout for children who have had trauma experience is really just referencing that these behavioral parent training packages that include timeout produce, good effects and don't cause re-trauma and that sort of thing. So the role that timeout plays in that is really unknown. I mean, I think they lay out a reasonable argument for why timeout would not be a traumatic event, and that it could actually be very helpful in the therapeutic process as essentially like an exposure. So if it did elicit some of those, traumatic feelings, that it would be done in this really safe, brief, calm situation of timeout. And so I think they do a nice job of laying out the rationale, but I don't think that question is really answered with any data at this point of the specific effects that timeout has. I think we need more data in general on timeout, not as a standalone procedure, because as I mentioned, it's never really a standalone procedure, but looking at timeout outside of a larger packaged intervention that includes lots of other parent training components.
Is there anything else in the Dads and Tully article that you feel is relevant to talk about before we get into some of the kind of the more nitty-gritty nuances of timeout in your research?
I don't think so. One question that I liked that you asked that we haven't really talked about is this, your question number 8, which is, what are your thoughts on how discipline practices fit into the greater theme of positive or negative parenting? And so what it got me thinking about is this issue of, I think we've become, and I think for very good reasons, we've become very focused on what get labeled as proactive strategies, or, arranging antecedent situations to prevent problem behavior from happening, which many times I think is essentially like just making people's lives better, which I think is really important and good. But the reality is problem behavior is still going to happen. If you spend any time around young kids, like, they engage in problem behavior. And it's
wait, what?
they all do, and some more than others, and it's going to happen. And so I think it becomes a problem. Sometimes I think we get so caught up in our proactive approaches and all of these, the arranging positive reinforcement is good and punishment is bad and never do punishment, that we forget not that punishment is always needs to be the consequence that gets delivered, but we need to give people strategies for what do you do when problem behavior occurs. So you can set up all the most amazing antecedent strategies ever, and problem behavior is going to happen at some point. And we need to not forget to equip parents or teachers with some strategies for what do you do when that does happen. And so I think timeout is one of those reasonable things in certain circumstances. When time in is really enriched, timeout can be a really good option for when problem behavior does occur after you have arranged all these other things to try to prevent it from occurring.
That is a very good point, that there is more to parenting strategies than sort of just focusing on that positive. It's sort of like planning for an emergency. There's a reason we do it, even though you can, have all the antecedent strategies for nothing bad to ever happen. Something will eventually happen, and it's better to be prepared of how to handle that calmly using appropriate techniques than to sort of just respond reactively in the moment to something that you were hoping would never occur. I know Dads and Tully were pretty, really kind of repeated that point of one of the reasons that they liked timeout and why it is such a good strategy to use is so that it can be consistent, as opposed to just reactive parenting where one parent just keeps getting louder as the child gets louder, and there's sort of that positive feedback loop of, getting mad. I'm getting a face like maybe I do that sometimes in my own house.
No.
I don't know. Maybe Dad just has Maybe something bit her. I can't tell. Possibly one of our children.
Well, the other thought too, if we're just thinking about big picture, timeout can also serve as a timeout for parents as well, right? Like, let's all take a minute right now in order to assist in that de-escalation. Not speaking with the behavioral function of timeout, but just more as a procedure that one might use in the house.
Yeah, if you've got a kid who will go and sit in timeout without your constant monitoring and blocking of escape from timeout, then yes.
I'll just put myself in timeout time and take all my toys with me, so there's nothing for the child to do.
Are you talking about yourself, Rob? Because you said the child. I'll take myself to timeout.
Yes, that's like Diana says. It is sometimes nice to feel like I will go to where I actually reverse timeout. I'll go to where all the positive reinforcement is, which is where possibly my angry child is not. What's that?
No comment.
What's that procedure called?
I don't think that's just called reinforcing.
Myself?
Yeah.
Escape.
Let's take a break, shall we?
That sounds like a good idea. All right, we will be right back with more with Dr. Jeanne Donaldson and a discussion of timeout. Don't go away.
Do you want to be a BCBA?
Sure, we all do.
Now you can come to Regis College in Weston, Mass. to get your graduate degree.
Choose from any one of these courses.
Masters of Science in Applied Behavior Analysis.
Masters of Science in Special Education.
Dual degree in Special Ed and ABA.
Or be eligible for your postmaster's certificate.
You can complete your degree and be ready to sit for the exam in 2 years. And our 2017 grads had a 100% pass rate on the BACB exam.
Come enjoy practicum placement support, ethics mini handbooks, PhD-level professors, small class sizes, and a service trip to Iceland.
If interested, don't delay. Supplies are limited. Learn more at regiscollege.edu.
Again, that's www.regiscollege.edu, regiscollege.edu. One more time, www.regiscollege.edu. See you there!
Before we get going with the rest of our conversation with Dr. Donaldson, I wanted to make sure that you all heard the news. ABA Inside Track is ACE approved. By listening to our podcast, you're able to earn 1 learning credit. Huzzah! All you need to do is listen to the whole episode, then go to our website, abainsidetrack.com/get-CEUs, GET-CEUS, and enter in some information, including 2 code words we've hidden in the episode. The first of those is playground, PLAYGROUND. It's the place where people play. Usually there are swings and monkey bars and a slide, perhaps. You know, a playground. Playground. And now let's continue our conversation. And we are back talking with Dr. Jeanne Donaldson about timeout. And when we left for break, we were sort of talking about the big picture of timeout. But now let's switch gears a little bit. And let's talk, Jeanne, about your research in timeout, which I know I read so many of these articles before, at times when I've needed to read about timeout, or I was like, what's a good timeout procedure? What are the rules, quote unquote, rules of timeout? And I found these to be so fascinating in just, let's drill down and let's look at what are the components of timeout in the literature, and let's test out some of them and determine whether what has been done is actually consistent with what we can find in research nowadays. And so the 2 articles that you recommended, I think are just great reviews of, let's look at 2 pieces of timeout in real depth and just continue to improve our understanding of the procedure. So you did these articles back when you were doing your doctorate program, or was it a different time?
Yeah, so I actually started the 2013 study as a master's student. It was when I was working.
Oh, that always makes me so sad when I hear that, when it's like, and I worked on this article for 15 years.
Yeah, it was, well, some of it was that I was newer to research then, but also as you know, the data weren't consistent. So I just wanted more participants, and that took a little while. And there was a whole transition. So I was I was working for the Behavior Analysis Services program, getting my practicum experience there. And my direct supervisor was Teresa Yakish. So she's one of the authors on the paper. And Tim Vollmer was overseeing the northern part of the state, like the program's implementation in the northern part of the state, which Brevard County, where I was, I guess, counted as northern. It's central. And Carol Van Camp was the research coordinator for that program. But so Teresa and I, we got interested in doing timeout research as we were training parents to implement timeout. And I noticed that the way that we were teaching timeout was either there would be no citations to support some of the aspects of the procedure, or there were some aspects of the procedure that didn't align with more current published research. Like there was the use of a release contingency, which the Mace et al. Paper from 1986 had suggested that release contingencies, at least in the form that they evaluated, are not effective. So quit using them. And so Teresa and I were interested then in going back and looking at different parameters of timeout to make the procedure easier for parents to implement and perhaps reduce some side effects. So in the process of that, then we started that study during my practicum, but then the funding was cut for that program. So Teresa moved to Colorado. Carol Van Camp is now at UNC Wilmington, the faculty member. And I went to grad school. I went to the doctoral program to work with him at UF to continue that research timeout. And because after I got my master's, I was just not ready to be on my own. I needed some more training. So that was a long way to answer your question about the 2013 paper. Began a long, long time ago and spanned, I guess, the end of my master's and then most of my doctoral program. And both of these ended up being part of my dissertation.
So do you still have like nightmares about any of these papers at this point, or that it's far enough in the past that it's not still weighing on you?
No, I love these studies actually. So I don't hate my dissertation. Unlike, I hated my master's thesis. Still hate my math. I shouldn't have said that because now people might be curious and look it up. Don't look it up. Don't read it. But no, the timeout research was really some of the most fun and interesting data that I got to publish and got to do. So no, and I've done some more timeout research that I've just been sitting on the data that hopefully will come out soon. But no, this was a lot of fun. This research was fun to do. It's fun to really, if you look at the data, it's just dramatic decreases in behavior. So we're talking about like the kid on the playground that the teachers are so over because the kid is just running around, stomping on other kids' sandcastles, shoving kids down the slide. Everyone is frustrated. The kid has no friends. And in some cases, or in other cases, is the ringleader and drawing in all of the other kids to do all kinds of problematic things. And then we implement timeout and it's like, boom, problem behavior gone immediately. The reinforcers associated with that are incredible. And the reinforcers associated with looking at those data, incredible. So no, I don't hate these at all.
Yeah, when I read about the throwing of the sand, I was like, I see the problem, right? Because that's a big problem on the playground. The sand throwing, the wood chips, not all playgrounds have wood chips, but when they are there, they often get thrown. And it's a problem for other kids. And they can't go into the sand area because there's going to be sand thrown at them. It's not good.
And so you talk about two articles, 2011 and your 2013 article. Are they from the same place? Like, is this just like a preschool or, a kindergarten classroom that has just a ton of kids that are like bad on the playground?
It's the toughest playground in all of Florida.
Like, this is a dangerous playground to go on.
No. So the 2013 paper, I think, spanned maybe 3 different schools, and then 2 of those kids the sessions were at home. And then the 2011 paper was also maybe at least 2 different schools.
Okay, that actually makes me feel a lot better because when you read it, it's very similar, right? You're like at home or where it's circle time or on the playground, and I'm like, that playground is dangerous.
It's the playground they based that TV show Oz on,
right?
Real tough.
The reality is that when you get like 20 to 50 kids on a playground at once, and the playground just isn't that big, you're bound to have some issues.
So true. So true.
There's always at least one.
Turf wars. Yeah.
So, Jeannie, the way you were describing it, was it literally, boy, I wonder about these release contingencies, and man, there's got to be a better way to get the kids to go to timeout rather than like chasing them under the structures and like climbing up the monkey bars after them. And voila, research. I mean, was that sort of the genesis of these two?
Yeah. So the release contingencies one, that one was really like looking at the recommendations from the parent training program that we were doing. And the parent training program recommended a release contingency. And I don't know, I was a master's student and I had maybe just read the Mace et al. Paper. I was like, but I know that there's research that says that this doesn't work. And so that kind of made me think, well, why are people still doing it? And then it wasn't just that it happened to be that one parent training program. It was everywhere. I mean, people still always, the recommendation is always like, oh, don't let them leave timeout until they're calm. And it was that way in textbooks too. I mean, behavior analytic textbooks would say that, despite there being no research suggesting that release contingencies work. So yeah, so that one was really out of the parent training that we were doing and just my kind of nerdy interest in that aspect. And then the other paper, getting them to go on their own, was really a practical issue of when you tell kids to go to timeout, they just don't. And rightfully so, right? I mean, you're asking them, go sit and access no reinforcers, and I'm asking you to leave a place of many reinforcers. So it's surprising when they do go, really.
Mm-hmm.
Right.
In terms of release contingencies, for our listeners, you're referring to the idea that timeout should or should not end based on behavior during the timeout period itself, correct?
Yeah, exactly. So just as the term suggests, that when you get released from timeout is going to depend on your behavior in timeout.
And in terms of setting up that study, it seemed pretty straightforward. I mean, it's a good thought for kind of a master student to think of like, let's see what happens if sometimes we have the release contingencies and then sometimes we don't. Can you talk about sort of how you developed the overall kind of experimental design and implemented this study?
I can't really take much credit for the research design on these. So I was a student, and so the 2013 paper, as I mentioned, we started doing that research first. And it was Carol Van Camp. So what I had initially proposed was this very long series of many, many reversals. And Carol was like, why don't you just do a multi-element of the timeout conditions and reverse no timeout in between? I was like, oh, that's brilliant. Thank you. So then we kind of stuck with that in what became the 2011 paper. So that was, the design is really Carol Van Camp's idea. And yeah, so the idea was, okay, well, let's make comparisons between a fixed duration timeout and a release contingency timeout, because there are really good ideas for why people want to use release contingencies. So the idea is, I want to teach you to be calm in timeout, because we didn't talk about this when we were talking about the controversy around timeout, but timeout produces usually, or many times, a host of problematic side effects. You get the refusal to go to timeout, tends to be the first one, and then problematic behavior during timeout, which varies by kid, but can be emotional behavior, can be aggression, can be disruptive behavior, trying to bang on the walls or grab at anything around, attempting to escape from timeout. And all of those things would be things that we would predict, right? We know from the basic laboratory from many, many years ago that aversive contingencies evoke and perhaps elicit problematic behavior or these emotional side effects and aggression, much like extinction as well. And so the idea behind the release contingency is, well, let's not reinforce the problem behavior that happens during timeout, and hopefully teach them that they need to be calm in timeout in order to get out, so that we will reduce those side effects. And additionally, there's lots of concern about a kid who is engaging in problematic behavior during timeout. If you just let them leave, now they're going to continue to engage in problematic behavior outside of timeout, and this is going to be a major, risk. And so we wanted to look at all of those sorts of aspects. So we didn't just we looked at the effect of timeout on problematic behavior during time in, so all that playground problem behavior. Then we also measured what we call delay producing timeout, so the problem behavior during timeout that would, in the release contingency condition, make you stay longer. And then we looked at what happens in the first minute after they leave. So that was the conditional probability calculation. How likely are they to engage in problematic behavior within the first minute of leaving timeout when they've been engaging in problem behavior at the end of timeout and any other time and during all sessions? Then what we found was that the release contingency did not reduce problem behavior during timeout. It didn't make it, the kids didn't engage in problem behavior upon leaving timeout generally ever. And so it wasn't a risk to let them leave after the fixed duration. But what it did do is it kept them in timeout a lot longer. And that's something that I think we really have to be cautious about when we're using timeout procedures is if the kid is in timeout, then they are not in the time in environment, which in many cases, time in is an opportunity to engage in appropriate behavior, an opportunity to learn new skills, an opportunity to engage with peers. So we don't want kids spending any more time in timeout than is absolutely necessary to reduce their problematic behavior. And the release contingency, at least in the form that we did, so the release contingency we used was we kept sliding essentially the last 30 seconds. So they had to be calm for 30 seconds at the end of timeout. And this was the same as the Mace et al. Procedure. So we were systematically replicating that. And so that release contingency, we would not recommend.
So it would just be, and you used 4 minutes in the study based on, I believe it looked like there had been research to point to the fixed time of 4 minutes being sort of the lowest you would expect to see timeout still be effective. Am I remembering that correctly?
Yeah. So this is maybe the question I get the most is how do we pick the 4 minute time? And that was based on earlier research that had parametrically evaluated the timeout duration. And 4 minutes was consistently effective. It was the shortest time that was consistently effective in the studies that examined duration. So things like 30 seconds and 1 minute timeouts tended to not be effective. And I wanted it to be as short as possible, but I wanted some research to point to. Now I'm doing a new release contingency study. I have a couple of data sets, and we use a 3 minute timeout just because we now use a giant 3 minute sand timer for the fixed duration timeout to make contingencies clearer. And they don't make giant sand timers in 4 minutes. And it turns out 3 minutes also seems just fine. So I would recommend a 3 minute timeout. I mean, I'd recommend whatever the shortest you can get away with. You know, the problem with punishment is if you start with too short and it doesn't work and you have to escalate up, that's a problem, right? So you want to start with a long enough duration that you feel confident it's going to be effective. And I would say 3 minutes, I feel confident in recommending as a timeout duration. But you might be able to get away with shorter. We just don't have the data to support that.
The parenting rule that they tell you 1 minute for every year of age is probably unnecessary.
Yeah. So, man, I have spent many, many hours of my life trying to find the origins of that recommendation.
Right.
And I can't. And the only thing that I think is that's an easy rule of thumb for parents to remember. So if you're trying to figure out, you know, how long should my kids spend in timeout? So I think my guess is that was in response to a lot of the old timeout procedures use really long timeouts. Like some of them are like 20-minute timeouts. You're like, oh man. I mean, some of the old timeout papers are cringy.
Was that for your 20-year-old who's still tantruming at your house and you got to give her whole...
I was actually hoping that you'd put me in timeout. I'd be in like a 39-minute timeout. That's like the perfect nap time.
Sounds perfect.
Yeah, doesn't it?
And so I think the response was basically to try to make sure that parents of young children were not using excessively long durations.
That makes sense.
But the problem is, I suspect a 3-minute timeout would be effective for like an 8-year-old. So now we run into, there's a point at which you might, I mean, maybe by 8, we're not using timeout as much. But, you know, if you've got your 6-year-old in timeout for 6 minutes, that's probably double what you need. And again, we want to reduce the amount of time people are spending in timeout. The whole point of it is just to reduce problematic behavior. And so if it does that in 3 minutes, then that's what we should go with. But people need to do more research to demonstrate these kinds of effects so that the recommendation can change and we can just set everyone at some sort of fixed, very short time.
I know certainly, like we talked about earlier, when people sort of, give me the look about timeout, I don't know, I'm a little nervous. When I typically recommend, well, we're just going to do a fixed time. We're just going to start with that. And if it's effective, great. And if not, we'll, have to look at that more. Usually just giving people a time. I think I usually suggest to people like 4 or 5 minutes. They tend to like the procedure more, just the idea, because I think sometimes they're thinking, I don't know, it's going to be like 11 minutes. I don't think I even have 11 minutes. I can stand here and watch this kid in timeout. And then if they get upset, I got to go to another space and do timeout. And when it's just, nope, it's just this time and then we're going to end it. They trust the procedure more, even though they don't necessarily know it's based on research. I could have just made that up right then and there to make them happy. I usually do remind them like, no, I read this in a paper once. And they usually people believe me at this point when I tell them that.
Nice. Yeah. It's also just easier if you have a set time, it's like, oh, set a timer for 3 minutes, done. As opposed to giving kind of a more wishy-washy answer about, well, it depends and you might try. I think then people are like, oh, this is already too complex.
You might. Oh, no, thank you. I want a procedure that's 100% effective and is in a book is like one number I have to remember.
Yeah, no nuance allowed. I just have to say, I think I'm not done with release contingency. So I feel like the story of the 2011 paper is super depressing. So it's like, okay, this didn't work. Problem behavior still happens in timeout. Quit using release contingencies. It's just making kids sit longer. Mm-hmm. But then it leaves everyone with like, well, what do I do when I send my kid to timeout and they kick me? I don't want to use timeout. So I also think we need other methods to reduce problematic behavior during timeout because it happens and we should expect it to happen because we know that timeout's designed to be aversive. We know that there are side effects to aversive contingencies. And so I think I find this, I like the paper, but I also find it deeply dissatisfying of like, well, what am I supposed to do? Because problem behavior during timeout is still a problem. So we are in the paper that I referenced that is not published and it's not even written. So I can't make any promises about when you might see it. What we did is we looked at reducing, I call it a titrating duration. So basically you engage in problem behavior during timeout and we add 15 seconds right then and there. You see it added to your time. And if you sit calmly for 30 seconds, you get 30 seconds taken off of your time. We start with 3 minutes. So if you sit nicely the whole time, then you only have to stay for 1.5 minutes. And for the 2 participants who have completed the study, that works amazingly well. We eliminate problem behavior during timeout or nearly eliminate it during that condition compared to a fixed duration 3-minute condition where we see the typical problem behavior during timeout. So I think there is hope. And I think that I don't think a satisfying answer is quit using release contingencies. I think what we need to do is find a better release contingency or find a better way to reduce problem behavior during timeout.
Are you referring to that in the manuscript that you're kind of, have the data for, but you haven't written yet? It's percolating. Are you referring to it as a release contingency in that regard, or would it have a different name? Because it sounds like while it sort of is a release contingency, it's not sort of the classic idea of a release contingency. It's almost like, like there's a little like mini reward within the timeout procedure, like the learning component that I think Dads and Tully referred to as like timeout is teaching you sort of some alternative things, or like how to calm yourself down is one of the goals. They didn't say it necessarily happens, but one of the goals is sort of teaching individuals like, oh, it's okay. And, you engaged in problem behavior, but now you can stop engaging in problem behavior and then go back to the way things were. I'm not sure. Are you calling it something different? I guess was my long question there.
I was still thinking of it as a release contingency and calling it a titrating release contingency, in that you can go up or down in time because your behavior in timeout affects when you get to leave. But yeah, it's essentially an additional contingency on top of the timeout contingency. But the release contingency that we used in the 2011 paper, that like 30-second criterion at the end, isn't the only option. So there's also like the resetting of timeout. So you could start the timer all over contingent on problem behavior. And I actually don't know that anyone has systematically evaluated that specifically, but it just feels like kids would spend a long time in timeout because
doesn't feel great.
Initial problematic responses might happen in bursts. And I don't like the idea of just resetting the time until they're calm. But, maybe that would work. Maybe, who knows? We need more data.
Yeah, but that does seem, especially if you're using some sort of minute per age criteria already for the length of timeout.
We're not doing that.
No. I'm just saying if one were looking at that and then resetting that time, I mean, you're starting to get into the, 30, 40 minute ranges.
That you never hear behavior analysts say, but it'll show up sometimes on like parenting websites that recommend timeout, not to start the timeout timer until they are calm, which is, as you might imagine, going to greatly prolong the duration of timeout, because we could sit here for a very long time waiting for a 3-year-old to calm down in timeout. So I wouldn't recommend that either.
So still more to come.
Yeah.
It sounds like on that. And I would be very interested in seeing if it had some similar results, at least for some of the participants in your other study, in terms of when you put these extra contingencies in place for the appropriate behaviors you want to see as part of the timeout procedure. At least for some of the participants, you do see it look more like, I think we'd all want timeout to be like, sorry, Billy, you're in timeout. Okay. And then they go to timeout. It's some tiny amount of time.
Yeah, I think too, you have to think about the behavior of the parents if we're expecting parents to implement these types of procedures. And that, in my experience, I've found that if the procedure is aversive, then it's usually more difficulty on the part of the parents to implement that as well. And you could have lesser procedural fidelity with that procedure. So if you're asking them to do something that's going to be long and arduous and requiring that level of specificity, then you're more likely to get some drift there and may inadvertently reinforce that behavior that's happening at the beginning of timeout, would be my guess. Mm-hmm. But I guess we don't know. Mm-hmm. But everyone just wants to get it over and done with. The child does, the parent does, and everyone wants to move on and get back to reinforcement. So I think, like you're saying, Jeannie, as short and as efficient as this can be, the better.
Yeah, we don't need to prolong the misery for anyone.
So, Jeannie, going on to the 2013 article, this one, like you said, stemmed from why do kids not want to go to timeout, and sort of looking at if you put in a different contingency, would you see more compliance with the overall timeout procedure on the playground? The students going to timeout when they learned that if they go quickly, the timeout was shorter, versus if they refuse to go or they have to be brought to timeout, they get the full timeout period, which I think was, again, 4 minutes, right? That one.
Mm-hmm.
So that's just the gold standard time, at least in that period.
Same rationale as the other one, that was the shortest duration from the studies that parametrically evaluated duration that was effective, that was consistently effective.
This study had students on the playground, but also there were a few at home. How did you find students at home? Was, again, the same idea? It was just families that you were working with as part of the parent training?
The ones where we were in home in that study were kids that were actually referred at school, but they had more problem behavior at home. So it was like the teacher, we were already working with the teacher because we were working with some other kids in the class. And then the teacher was like, oh, this parent is complaining that so-and-so is always engaging in problem behavior at home, but we just don't see that at school. And so that's how we would get connected.
It's one of the things parents don't love hearing when they talk about problems they're having at home, having a teacher shrug and go, I don't know, they're perfect at school. Like, that solved their problem. So would you mind describing to listeners sort of the general makeup of the study itself, kind of the variables you were looking at, and what was the overall procedure?
Sure. So we were looking at reducing problematic behavior during free play time. So either like recess or free play at home. And again, the reason we pick those times is because there are so many reinforcers in time in. So kids on the playground have access to their peers and all the playground equipment, and sometimes the teacher's attention as well. And it's a time that's ideal for timeout, because sitting on the side and seeing everyone else having a great time is a really effective way to reduce problematic behavior. But yeah, the idea was kids don't always go. So you tell them you can't do that, go to timeout, and they say no, or they run away from you. And then what do you do? And, if you're...
They found our weakness, running away from us. So no.
Yeah, if you're, student of behavior analysis, you run after them and escort them to timeout. But that's not the most fun experience either. And if you're a teacher, then perhaps you stop using timeout. So what we did was we compared of a 4-minute procedure. So just a standard timeout. We say go to timeout, you refuse, or you go. It doesn't matter. You stay for 4 minutes. And we compared that to what we called a 1 or 4-minute timeout. And so this was when, if the participant went to timeout on his own, they were all boy participants. If he went to timeout on his own, made it there in under 10 seconds, then he only had to stay 1 minute. But if he didn't, so essentially if we had to help, then he would have to stay for 4 minutes. So reducing the timeout duration contingent on compliance with the timeout instruction. And for 4 of the 6 participants, this worked beautifully well. And we saw huge increases in compliance with the timeout instruction. Both procedures reduced problematic behavior during time in, but we saw a nice increase in compliance in the 1 or 4 minute condition for 4 of the 6.
Any thought as to why it wasn't effective for 2 of those students? They didn't learn the contingency potentially, or it just timeout was so aversive to them that they were going to run away from it no matter what?
Yeah, no, I think they are younger too. And so I think we gave instructions prior to the start of each condition about what the contingencies were, but I don't think those kids really knew what we were talking about. And then when you don't comply with the timeout instruction in the 1 or 4 minute condition, it looks identical to the 4 minute condition. So you still have to stay for 4 minutes.
Sure, yeah.
So I think they failing to contact the 1 minute contingency very frequently, I think prevented discrimination. So, and I think that I would still generally recommend this procedure for everyone, but I think there are things that you could do to make it much more salient. So we didn't do these things, but you could easily start a countdown. So if they have to make it in under 10 seconds, start the countdown 10, 9. And I don't know, now as a parent of young kids, I find myself counting down constantly.
Oh man, it's like magic sometimes. Our littler one, he's spinning around in the hall, won't brush his teeth, and I just start counting. And he just thinks it's the funnest thing in the world. And it's like, no, this is supposed to be scary. It's counting. And he's just like, yeah, I can beat your timer. I'm so excited. Yeah,
it's unclear what the function always is of that. Is it an avoidance response? Are you avoiding my physical prompting? Or is it fun to beat the clock? Who knows? But yeah, the counting down seems to work amazingly well. So I think that could also be really salient. And lots of kids have a history with, I need to do what you ask before you end your countdown. So maybe harnessing that experience also. I think we also could have made it clearer to them when they were successful and made it and only had to stay 1 minute. And we could have used better timers. So I was using little timers that were digital timers that a 3-year-old doesn't know enough about numbers and timers to be able to tell that it was set for 1 versus 4 minutes. But, now they have apps that have these wonderful visual timers that make it really easy, that you could make it pretty obvious when you've got your 1 minute versus your 4 minute. So,
Jeannie, was Brendan a mistake with the rule during baseline? Because you're like, we did it for 1 participant. And I was like, oh, that sounds like a mistake right there.
No, Brandon was not a mistake. I mean, and telling Brandon the rules in baseline was not a mistake.
Oh, okay.
So I think Brandon was the last participant that went through the study. So they're stacked in an order that is most visually appealing, but not in the order in which they appeared in the study. And so I think it took us 6 participants to think, I wonder if we just told them the rules.
Yeah. Okay. That makes sense too. I was wondering that, or I was like, or, someone ran it as a student and they're like, I don't know why they're not telling them the rules in baseline. I'm just going to tell them, right? Because that's sometimes what happens when you have other people run your sessions. And then you're like, why did you do that?
Right.
No.
When you'll read in there and it says due to observer error, right? And
Right.
you're like, ooh, someone got in trouble.
No, this was not anyone getting in trouble. This was probably what happened was I presented some of the initial data at a conference or something, and someone probably asked a question about well, did they even know the rules? I was like, oh crap.
Good point.
I'm going to make sure they do. I mean, the reality is the rules were standard rules. They were set by the teachers or the parents. So these weren't we didn't come up with these things. And, the teachers are pretty good about explaining, but probably at the point at which we started intervening, the teachers were not still explaining the playground rules every time before going out on the playground. So it's still possible that there could have been some effect of that. Unlikely, because and I'm surprised that you haven't asked me about this yet, because the reviewers, when I submitted these papers, reviewers were very upset that we didn't conduct a functional analysis, and also that we implemented a punishment-based procedure before demonstrating that reinforcement wouldn't have worked. So I want to talk about a couple of those things. But going back to the rule issue, that I think the stating the rules probably was unlikely to have any effect, not in part because the kids already knew the rules, but the problematic behaviors were contacting reinforcement that would compete with, whatever other threat that a rule would accompany, unless it was consistently followed with something like timeout.
So, Jeanne, going back to the idea of using an FA, or how come you didn't use an FA? I mean, honestly, in reading these papers, I just assumed, well, you're at a school where these are the procedures, and the question was not, should the teachers be allowed to use these procedures? The question was, can we make these better procedures? I mean, was that sort of your thought in conducting the research? I mean, going back, would you have conducted an FA for all of the students before implementing any of the other timeout, procedures?
No, you're right on. So, yeah, my thinking was not, I need to conduct an FA. And still is not. My thinking was, this is such a common procedure that's used for kids this age. These teachers are using it, but inconsistently. And what can I do to evaluate this to make it an easier, better procedure? But then in thinking about it, and thinking about, well, what is the likely behavioral function of problem behavior on the playground? Well, it's probably varies based on the behavior, but I would guess it's going to be maintained by peer attention in some cases. So the I stomp on your sandcastle tends to get quite a rise out of your peers. And some maintained by automatic reinforcement. So it's fun to jump off the swings. Or if I push that kid down the slide, I get to use the slide. And that kid's been sitting at the top for a while. So I think a lot of this behavior tends to fall under those two categories. There are really no demands placed in that context other than like stay in the general playground space. So not really any opportunities for escape maintained problem behavior. If you do something, particularly egregious, then you might get the teacher to run over, which could be pretty exciting too. So maybe teacher attention in some cases.
It does seem like, if this were a study in which we need to look at timeout in the context of, completing homework or something where there might have been an escape component as well as, the attention or some sort of automatic reinforcement, then perhaps the FA would have made sense. But timeout does sort of feel like it's going to, kind of be a catch-all procedure. And like, well, it could be any of these functions, but so what? To some extent, timeout is either going to work or not work. And if it works, it's because we captured the functions. If it doesn't, I guess it was possibly escape maintain problem behavior and we shouldn't have used it to begin with, but not typically the context in which timeout is implemented. Because it could be, but not typically.
Yeah, well, I think when we see timeout implemented ineffectually is sometimes when teachers use timeout during aversive instructional periods. But they're using timeout procedurally, but not functionally. The playground is a safe bet, I think.
Yeah.
How much more do we need to know? Come on, it's a playground. Where are we getting away from?
The other point I want to go back to is the one about that, why not try a reinforcement-based procedure first? And I've thought a lot about it, and I want to do this study in the future. So anyone out there who is interested in being a student, come work with me. Or I guess other researchers, feel free to scoop me because I've been thinking about this a long time and haven't done it. So go ahead. Someone needs to do it. But I want to compare. I've tried to think of what would a reinforcement-based procedure look like on the playground. So we could arrange something like, and make it roughly equivalent. So we could arrange some sort of like DRO. But if you think about having a teacher implement a reinforcement-based procedure during the playground to try to reduce problematic behavior, you're talking about imposing what I would consider a pretty intrusive intervention, where a teacher is going to need to be interrupting appropriate play among peers in order to deliver reinforcers. What are the reinforcers going to be? I mean, if it's praise, wonderful. But if it's anything else that feels really artificial on the playground, and even if it's praise, I'm not sure how well, I mean, in preschool, teacher praise is, well, Claudia Dozier has some really cool work suggesting teacher praise is not a great reinforcer.
What about turning the bubble machine on or off?
Yes.
Oh, the bubble machine. Yeah. So, we could get creative with it, but it's still, then that's going to interrupt whatever. So if kids were creating a story that they were, pretend playing together, and then you turn on the bubble machine because they haven't had any problems, now you've interrupted their story and they're going to go and run and chase bubbles, which is
You're right.
fine, but still missing out on those like opportunities for kids to interact with each other and learn those kinds of skills. And so it still makes me wonder about if in this setting, if timeout isn't actually a less intrusive procedure than what we might arrange as reinforcement-based procedures. And could we even get the reinforcement-based procedures to be as effective in this context? Because of that, you're interrupting my appropriate play sorts of things.
Perhaps this is a good time to segue into our dissemination station if we're going to talk about the future of timeout.
We're here.
All right. So, Jeannie, you kind of already brought up a couple ideas as to, where is timeout going in the future? Because I know clinical psychology is sort of owning timeout and mostly looking at sort of packages of intervention versus looking at drilling down into the components of timeout. So when we look at the future, you mentioned some ideas that you've already had or that you're in the process of kind of getting going, or maybe you're hoping someone else does it now because you're ready to do something different with timeout. But please, keep sharing kind of some ideas as to what else do we need to know about timeout? We talked about reinforcement a little bit. What other pieces?
I think it would be really nice to capture, and this is hard to do, which I think is maybe why I haven't done it or anyone has done it, is capture the positive side effects of timeout. So what happened, what I got to see happen on the playground sometimes. So I keep coming back to the kid who would stomp on other kids' sandcastles. I love that kid so much. And he was just like your textbook naughty. And he really didn't have other friends. The other kids wouldn't play with him in baseline. And so he would go over and do mean things to them. And then once we start implementing timeout, he had to do something else. He couldn't go over and stomp on their sandcastle, or he'd have to go sit in timeout. And timeout wasn't any fun. So he made friends, but we didn't capture that in our data collection. And so these are just anecdotes, and you have to take my word for it, that he had a better time, and we got to see all kinds of new social behavior, appropriate social behavior, because the timeout contingencies were on a large enough swath of topographies that he basically was forced to figure something else out. And the things he figured out, I think, were also much more likely to earn him friends than if we were to pull him aside and give him a script for initiating conversations. This wasn't a kid that needed that sort of explicit training, and I think that could have made those kinds of social interactions not go as well. And so capturing those kinds of side effects, I think, is really important.
Might that be the population that you could look a little bit more specifically at reinforcement? The students who the issue isn't that they couldn't interact appropriately, is that they chose not to interact appropriately. And then when that was no longer the more reinforcing of the options, they began to engage in appropriate social play. I assume that there would be some population that would not know what to do. Well, I can't step on sandcastles. That doesn't get me the reinforcer, whether it's attention or it's fun to do. But now that I go to timeout, when I do that, I no longer stamp on sandcastles, but now I know what to do, or I haven't naturally learned to play skill.
That's where you want to know the function.
Yeah.
Yeah. So I think that essentially what you're suggesting is knowing a bit more prior to starting the intervention about kind of baseline social skills. I think the issue is it's hard to know whether he, loosely speaking, had the skill and wasn't using it, or didn't have the skills and those skills were naturally generated from the context of I have to do something different, and we're seeing some natural variability get reinforced.
It sort of reminds me of some of the good behavior game studies where when the good behavior game was in play with students who were in the sub-separate classroom for kids with challenging behavior or low social skills, it turned out the kids had social skills all along once the positive reinforcement was in play. They just didn't use them until the contingencies sort of moved in the direction of the social skills being reinforced rather than all the other problem behaviors.
Yeah, are you talking about the Groves and Austin 2019 paper?
You know the citation better than I do. I'm going to say yes, that's totally the one I'm talking about.
I love that study. I think it's brilliant. And it's like the kids with behavior disorders that are cursing and threatening each other in baseline, then in the good behavior game are cheering each other on.
Yes, that's it. We've done a couple good behavior game episodes, so some of the article citations tend to slip my mind, but I remember the findings at the end.
Yeah, so I think we need to do more of that. And in general, I think we need to know more about the other effects that our procedures have, things like long-term effects and effects on caregiver and child relationships. That I'm sure a bunch of people just bristled at my suggestion that we do that, but I think this is why people get concerned about, some of the procedures we use. We are wonderfully good at demonstrating the effects on the target behavior, but we frequently, and the immediate effects. But then once we've, quote unquote, fixed the problem, we move on and move on to a different target behavior. But I think thinking about what are the lingering effects, and these are harder to capture, or what are the side effects, or what are the effects on the relationship you have with the person implementing the procedure. And that was another thing I saw with that participant, Brandon. In baseline, I was in his home and he didn't enjoy me being there. And I'm like playing with him, doing whatever he wants to do. And the rules were very unclear. Like he'd engage in problem behavior and look at me like, what you going to do? And then when we started implementing timeout, then he had a blast. We had so much more fun because it's like, oh, I know exactly what I can and can't do. The rules are really clear. And, I think clinical psychologists talk about that as kind of, there's safety and boundaries. And I think some of that has to do with the effects of procedures on caregiver-child relationships or adult-child relationships. And I think those things would be good to capture, especially because if we're using punishment-based procedures, and that's, again, with timeout, that can't be all you're doing because time-in has to include reinforcers. But still, if you're spending most of your time, if most of the interactions you have are aversive, then I would expect that you're going to have some other side effects that go along with that, avoiding that individual. So I think that those kinds of things would be really important too. And even to that end, preference for timeout procedures. I suspect that some kids might prefer timeout over extinction. Timeout is clear. I go, I serve my time, I sit, and then I'm done, and I go back. So I think there might be circumstances under which kids might prefer timeout contingencies over others. I think that's important to assess whenever we're working with people. How do they want their own behavior changed?
That's a very good point in terms of looking at treatment options, looking at that preference. Jeannie, any other ideas that you have kind of cooking for where timeout research should be going?
The last one I'll toss out there is, as a parent, when I implement timeout with my own kids, especially when it elicits emotional behavior and there are tears at the end of timeout. The behavior analyst me, when I was implementing timeout with these kids in the studies, I just, let them go, say time's up and send them back and whatever. But when it's my own kid, like, I want to hug you and comfort you and let you know it's okay. And we don't really have any data on what should happen right after timeout, other than you get returned back to time in. But now timeout, I'm suggesting that I think some of this emotional behavior is elicited. And if that's still going on, then there are essentially different establishing operations. So I don't necessarily want to go right back to my toys because I'm sad and I'd like for my parent to hug me. And I'd like to be able to tell parents with confidence, yeah, hug your kid. and it's not going to ruin timeout. Just give them a hug, tell them you love them, and talk about, the rules and what to do next time at a time away from problem behavior. But I want some data on the extent to which we can provide attention that really was not available in time in. Not that, I'd hug my kids anytime, but that during the time in before problem behavior happened, it wasn't like we're sitting together, hugging. So this is now a new special form of attention that's being provided right after timeout. So some might suggest, well, now you're adding a special reinforcer following timeout, and that might reinforce a chain of behaviors. First, I engage in problem behavior, then I get all sad, and then I get your special attention.
I would love to see that research as well. And I do worry sometimes that we as behavior analysts get so caught up in what might happen that we forget just the humanity of the situation.
I think that's a good way to think about it. But it would, and so I think it would be nice, because we're behavior analysts and we love data. It would be nice to have some data saying, no, just be a normal human. And tell parents they can be normal humans too. Like, we have data that you can hug your kid. We don't. So, we still need those data.
I suppose it could go the other way too, though, Jeannie, in which it's like, no, the data say don't be a normal human, be very cold and aloof from your child after timeout.
Oh, that would be such a bummer. But yeah, it's true. That could be, or, I don't think that would be the recommendation, but just basically keep it brief and move along.
Yes.
Redirect.
I'd be shocked if it were like, nope, you have to really just cold shoulder him right afterwards too. That's the best procedure. I would be shocked about that. All right. Well, Jeannie, before we wrap up, I'm sure our listeners would love to hear at this point in time from someone who has done so much research and thought so much about timeout as a procedure or part of a behavioral intervention package. What are the known quantities? So if you had to write down, the commandments of timeout right now for a practitioner, what are the pieces that these are known, do it like this, versus the ones we've talked about there? There's variations. It might or might not matter which variation you use. Like, what are the definites?
Number one, consider the time in context. Timeout is timeout from positive reinforcement. So time in has to have some reinforcers. And again, those could be non-contingent reinforcers or, positive reinforcement contingencies, but it needs to be enriched. So I think that's first and foremost the biggie. And then keep it brief. So, 3 or 4 minutes is probably plenty for just about anybody. I think the other pieces I would strongly consider are using a non-exclusionary timeout procedure, like the contingent observation or sit and watch or whatever name you want to give it. But basically, you should be able to implement timeout in the same place where the problem behavior is happening, just in a place where they can't reach the fun stuff. Or thinking about timeout less as a place and more as a procedure. So using things like the timeout ribbon, so you don't have to move anyone. I really think where we get into issues is when we start looking at exclusionary procedures. And especially if we're in the realm of kind of common behavior problems in early childhood, then I think a non-exclusionary timeout is really going to be most appropriate. And if you can't make it work there, so if you can't safely keep the kid in timeout and manage problem behavior that's happening during timeout, or safely get them to timeout, then I think consider something else. Timeout's maybe not the procedure to use. And on that note, anticipate problematic behavior during timeout. It's likely to, consider yourself lucky if you first use a timeout procedure and get no problematic behavior. That's great, and it does happen, but I would say it's not the norm, especially with the really young ones when this is kind of their first experience and they're learning the ropes. Timeout is upsetting, and that's okay because it's brief, only briefly upsetting, but you have to be ready to manage some problematic behavior.
So do not assume that the kids, when told, oh, you need to go to timeout for hitting, that they'll look like, sad Charlie Brown and just kind of walk over to the little chair and stay there. Probably going to be a little different. Okay.
Yeah. Unfortunately.
Ah, well. Jeannie, it was such a pleasure to have you on the show tonight. It was so great to get to talk about timeout. I know we all very much love hearing about research, both from the standpoint of what did we learn, but also when there are fun anecdotes to go into the development of that research. They just don't make it into the paper for, whatever reason, I guess. They cut that out, maybe?
Yeah. Limited journal space. They don't want you to gush on about the various silly things participants did.
I feel like people would have more fun reading research if some of those anecdotes actually made it in. But I suppose that would sort of devalue some of the fanciness of the journal if they had that.
You're not that worried about the entertainment value.
Oh, it's too bad.
Go back, if you read like that Wolf, Risley, and Me's 1964 paper, it's like a story. I mean, if you read the old research from the 60s, most of it is like they're telling you a story about the participants. I mean, sometimes you don't get enough in the method, so you couldn't replicate what they did, but you get the story piece.
Montwolf could tell a good story.
That's true. And you mentioned at the beginning of the show, but it'd be great if you talked about it again, where people could find you and your program down at your school.
Yeah, so I'm at Louisiana State University. I'm in the Department of Psychology in the school psychology area, and we have a really unique school psychology doctoral program that is very behavior analytic in its focus. But also you pick up a bunch of other skills along the way, including differential diagnosis skills. We have specific coursework and training in cultural responsiveness. Our program director, that's actually her research area. And I know behavior analysts right now are kind of clamoring for that kind of experience. You also get experience in working with really diverse populations in the Baton Rouge and New Orleans area. So it's a cool program. So anyone who's interested in pursuing a doctoral degree that is behavior analytic in its focus, but is also makes you eligible for licensure as a psychologist, then you should check it out. My email is jdonaldson@lsu.edu. Oh yeah, so if you Google my name and LSU, I come up. So you can find my website. You can see my lab page, see my students. I have the best students. They're super awesome. I get to collaborate with some people who are going to be going on and doing really amazing things. And then I get to do all kinds of fun research that I would have never done on my own because they have all kinds of cool ideas.
Again, we want to say big thanks to Dr. Jeanne Donaldson for coming on the show and talking with us for such a great chunk of time. I mean, it's always such a pleasure when we have a guest on who has so much to share about their research, about their thoughts on the topic at hand, anecdotes of the research, the facts of the research. There was so much we got to cover tonight. And I hope all of you listeners were as excited to hear about it as we were. So thank you again, Dr. Donaldson. Before we wrap up, just want to make sure everyone gets that second secret code word. It is hourglass, HOURGLASS. It's like that big hourglass-shaped object. It's got the big top, the big bottom, really skinny middle, sand falls through, lets you keep time in an old-timey fashioned way.
Jasmine gets trapped in one by Jafar the snake.
In the movie Aladdin.
Beauty and the Beast.
No, sorry. Beauty and the Beast. Hourglass. I want to also say a big thank you to all of you for listening to ABA Inside Track. If you like the show and haven't, why not subscribe? We're on Apple Podcasts, Spotify, Stitcher, really anywhere you can get your podcast. We are there. Why not think about leaving us a review as well? Actually, don't just think about it. You should leave us a review as well because it certainly helps us. There are a lot of other ways too, besides giving us reviews on those podcast platforms, that you can get in touch with us. You can find us on all the social media sites, Facebook, Twitter, Instagram, Pinterest. You can find these episodes posted on YouTube with the YouTube subtitling features. You can also find these posted on our website, abainsidetrack.com, where we have links to all of the articles discussed in this episode. And of course, there is our Patreon page, patreon.com/ABAinsidetrack, where if you enjoy the show but want a little bit more, including bi-monthly social get-togethers with other patrons and with the hosts of the show, and 3 additional CE opportunities where we do our book club podcast, 3 per year. Check us out at patreon.com/ABAinsidetrack. And of course, there's always old-fashioned email, abainsidetrack@gmail.com, where you can listen to any feedback you have, as well as ideas for episodes or anything else you'd like to chat about. And in addition to thanking Dr. Donaldson once more, also a big thank you to folks who help us make the show. That includes Dr. Jim Carr for his recording of our intro and outro theme song, Kyle Sturry for our interstitial music, Dan Thabit of the Podcast Doctors for his editing work, and Hollis Irvin from the Sycamore Workshop for his visual design. We'll be back next week with another research-filled episode, but until then, keep responding. Bye!
Bye.